This episode is brought to you by Human Kinetics, the information leader in physical activity and health, providing quality resources for students, faculty, and professionals across the range of athletic training, sports medicine, and exercise science disciplines. Human Kinetics' catalog of products is developed to provide you, the athletic trainer, with the education and resources you need to keep your athletes in top condition. Human Kinetics is pleased to offer NATA members 20% off their purchase. Visit the NATA member perks page for more information. Welcome back to NATA-Cast. Mollie and I are looking forward to today's episode as we take on a topic that has been part of the conversation in athletic training for decades, and yet continues to be one of the most significant, if not the biggest, pain points in the profession today, and that's salaries. This is not a new conversation, but it is an important one, and it's one that deserves continued attention, transparency, and thoughtful dialogue.
One of our biggest goals with launching this podcast is to create a space for open, professional conversations around the biggest issues facing the profession, even in moments where perspectives may differ. Recently, we came across a conversation on social media that raised questions and perspectives around compensation and the role of the association. And rather than respond to the moment or choose to ignore it altogether, we saw it as an opportunity to pause, open the door, and engage in a more intentional conversation with varying perspectives.
We see this as an important moment to lean in and engage more directly on topics that matter most to our members. We know this one episode's not going to solve everything, but our hope is that it serves as a meaningful starting point or a recommitment to the association's role in helping address this challenge.
And as we move throughout the year with the new salary survey data, continued work from the compensation task force, and the rollout of our new strategic plan, we're focused on evolving this from conversation and awareness into action and impact.
To help us do that today, we're joined by three individuals who are engaged in this conversation from different perspectives. Dr. Tyler Lesher is joining us after helping spark broader dialogue around compensation across the profession. Dr. Annaccone is an NATA volunteer leader and the voice behind Make It Make Sense, where he focuses on solving challenges through systems-based solutions. And Murphy Grant is the co-chair of NATA's Compensation Task Force, helping lead the work around resources and recommendations to improve compensation for ATs nationwide. We appreciate all three of them taking the time to be part of this conversation today. So with that, let's get into it.
Hey everyone, Tyler Lesher. I'm a private MBA performance therapist, athletic therapist. I'm currently working in Dallas now, so I'm finally in the DFW area with you guys.
Hey everyone, Annaccone, clinical associate professor at UT Arlington in the MSAT program and private athletic trainer.
Hello everyone, my name is Murphy Grant. I'm an athletic trainer with Cleveland Cavaliers and owner of Grant Sports Performance and Therapy.
Let's ground ourselves in the data. The average salary is $68,000, and it's increased over time, but it still sits below other healthcare professions. So, for all of you, our guests, when you hear that number, what stands out to you the most?
For me, just starting, when I hear the term 68,000, I think that's a barely livable wage. I think it used to be, by all means, and I think what happened is a long time ago, we had athletic trainers who were in the profession, and I'm not going to call out all the old heads or anything like that, because I don't think it doesn't really matter, but I think what happened was that they got to the point to where the world didn't cost as much to live as it does now. And what happened is cost of living has greatly surpassed. And it's not just athletic trainers. We're talking many people, Americans. That's a whole different political thing, way above my pay grade and always will be. But the cost of living has greatly surpassed athletic trainers' livable wage, okay? And I'll be the first person to say I've been very vocal about this to everywhere that I've lived, every place that I've worked. I've gone from working for absolute pennies of $30,000 for the Charlotte Hornets when I thought I was going to be making hundreds, and then going to bigger school out in UCLA where I thought I'd be making X amount, and being quickly found out that I was going to be on a paycheck to paycheck type of lifestyle. I do think that what the NATA does is highly positive, and I think that it's doing everything that it needs to in a sense of advocacy. I've had many talks ever since this post came out. I think the biggest thing that the NATA needs to do is express to their members and non-members what exactly it is you guys do. because as somebody who's not, I'm not an NATA member right now, my life doesn't change at all whether I'm an NATA member or not. So I think that gap right there needs to be defined, right? And more information. And it sounds just from our little bit of our conversation now that you guys are trying to do these right things, which I fully applaud. I do want to say one quick thing. I wasn't saying strike on the NATA. I was saying I think athletic trainers should go on strike. And I stand by that, saying that if the first week of college football came around and all the athletic trainers went on strike and every college football coach said, to hell with this, pay our people, I guarantee that would happen, because I've seen it happen with some schools, and I just think that there's some juice there. But that's just me going on a whim.
We will definitely come back to that in a little bit. Adam or Murphy, anything to add?
Yeah, with the 68 average, I agree with Tyler. It's a solid middle class income if you think about the US. The biggest thing is again, I agree with what he said, that the cost of living in different cities is outrageous. And in some cities, it's actually really good. Depends on where you live. But knowing that 68K is the average, there are some individuals who are making considerably higher wages than that and higher salaries, and some that are making considerably lower to come up with that average. But let's even peel all the way back. Historically, when you think about athletic trainers, we are behind the scenes. We are hard workers. We take care of our athletes. And that has been a huge push by the NATA, is patient-centered care, taking care of your patients, taking care of your athletes, care. And now we are having the conversation about the salary. For years and years, I've been in a profession for 28 years, and ATs have always been overworked and underpaid. So I'm glad that we're having this conversation to catch things up. I don't think it should change on how hard we work, because that is one thing we can control. But what we need to begin doing as we continue to have this conversation is stop being behind the scenes and be in front of the scene. And that is one thing that once we get through the conversation, I want to hit on as a point, that when you look at some other professions, they are out front. You see them. The ATs you don't see. And that can help with some of this conversation that we're having.
Adam, would you say that aligns with what you're seeing too, or is there anything else that surprised you with hearing that average?
No, I think Murphy hit it on the head in that we have to keep in mind this is just an average, and you have really high salaries and really low salaries. So for those athletic trainers who are coming in, doing their job, going through the daily grind, and they're making less than 68,000, they are living the frustration. They are not able to afford everyday bills, and they're waiting for something to change. They've been the good soldiers. They've been putting in the good fight, and they haven't seen significant progress. They've seen that average go up, but has that average gone up in a predictable leverage type way that gives them hope? And I think there's a lot of individuals that are losing hope that we can grasp onto a livable pay, because they have to put food on the table. And so I think that's where a lot of the frustration comes from. And so I think the task moving forward, and even picking up on what Murphy said and what Tyler said, I think the task moving forward is, a lot of people know what athletic trainers are now. They at least get the premise of it. At least in my conversations, they can put some pieces together. Yes, they may say, oh, you handle the water, or you tape, or what have you. But I view that as progress, because when I first said athletic trainer, they had no idea what that was. So I think we've made significant stride there. Now, as a profession, we need to start increasing the salary and selling our services in a way that we can get that average jumping in a predictable manner that really speaks to the leverage of what we have to bring to the table.
And I'd piggyback off what both of you guys just said. Is Murphy hit it on the head, in that going from behind the scenes to in front of the scenes. And at the end of the day, like, people won't pay for something that they don't understand. At the end of the day, I can say strength and conditioning. The general public goes, you do strength and conditioning. I can say massage therapy. Someone goes, you give massages. If I say athletic training, the most people in the public say, what the hell is that? They have no idea. I think that's got to be one of our main focal points moving forward is, Murphy said, going from behind the scenes to showcasing what we do and truly like getting it out there. And that's something that I've really tried to do. And I'll be 100% honest, I've lost jobs off of my social media by putting things out there and having a brand and putting things out there. As I speak with people in the NBA all the time saying pretty much they'd never hire me because of the social media. But I think it's important for us to not be behind the scenes anymore. And we have to showcase our skill sets and the things that we do day in and day out. And that's the only way people will understand what we do. If we stay behind the scenes forever, not going to change. That's just the reality of it. And the only way, in my opinion now, right, because general advertising is gone, right? It's not like we're going to take out an ad or a commercial and say, this is what athletic trainers do. Everything has to be done via social media, Facebook, Instagram, TikTok, whatever it is. It's the easiest way to be done for free to reach mass amount of people at any given time. And that is a huge piece to getting recognition for what we do. And I truly believe and I stand by that forever, because that's how you're going to get people will start beginning to understand what we do. So therefore they'll start paying for it, if that makes sense.
So really what I've taken away from our conversation up to this point is that this really isn't just about salary, but it's also about the systems around it, right? Autonomous practice, the practice model of which you're in, reimbursement, all those things. So one thing I'd love to talk about next is how much do things like physician oversight or team-based care actually impact the earning potential?
I think it kills it. Yeah. I think that as long as we are that stepchild that can't do anything on our own, like everything must have parents' oversight of what we do, I think that it's forever going to limit us. We are forever handcuffed by having physician standing orders versus being able to be our own providers. I do think that plus us getting third-party reimbursement will definitely impact us. Our salaries will go up significantly. I think what you'll end up seeing is more people going into the private world, knowing that they can do that more. I don't know exactly how team billing will work out, whatnot, of how much the university is going to take out, because the top tier university is going to take their chunk before it gets to the athletic trainers anyway. But I think that there's a lot of promise there. But if in the private world, which I've only been in for 6 months now, if I were able to get third-party reimbursement and then really just do what I want, complete autonomy, I would say that like my client list would expand exponentially and I'd be buying another house and all these different things, because there's so much room for growth with those two pieces, for sure.
Tyler, how do you reconcile that with the fact that a lot of even physicians right now are going more to just fee-based care or to not billing, that the billing and the insurance and all the things that come with that are just a losing battle in a lot of places?
I think cash-based systems, you see it a lot. I think people are giving higher quality treatments based on cash-based systems than they are based on the routine. Like here, if I give you a moist hot pack, I can bill you $8. If I give you ultrasound for 10 minutes, I can bill you $48, whatever it is. Cash-based is just really easy, and I get why doctors are doing it, and other PTs, ATs, strength coaches, whoever it is, get it, because I think the quality of care that I provide for that person, for knowing like how much I'm getting paid for just say one session, I'm going to give them my everything. I'm not sitting there checking a box. And I think that's something that we all want to do as athletic trainers and caregivers, and doctors do coincide with that a lot of times. I think that's a big piece that we fell out of for a long time, right? As we just got into, we need to figure out, or at least most clinical providers got to the point of we just need to check the box and get third-party tuition or whatever. And then if you're an athletic trainer, you're like, I'm getting paid the same no matter what. I'm on a salary. Whether I give you 5 minutes of care or I'm getting yelled at by a coach, whatever it is, I'm here. So you lose that, everything that we talked about, that drive of being like a high-level clinical expert. And it turns into a battle with that. I think that's where the cash-based system and private world really kicks back in for the better.
Murphy is chair of the compensation task force. I know you guys talked a lot about reimbursement, having autonomous oversight for possibly doing cash-based care. What was the work or the finding or resources of that task force?
Actually, we found a lot of things, and I'm going to come back to that, Katie. Let me throw something onto some of the things that Tyler was sharing. Who are we, at the end of the day, comparing ourselves to? when it comes to salaries. I think that is important to know. It would be amazing if that average salary went up to $75K. That's $7,000 more than what the average is now, which is a really good pay. And I don't think it's unreasonable to ask that. But to help our cause, one big thing is we have to be willing, smart enough as a profession, and not saying that we're not smart, but steadfast, that's probably a better point, but not accept the low paying jobs. If they're going to continue to offer the low paying job and we continue to accept it, then they will continue to offer it. When it comes to the third party reimbursement and the autonomous practice, I don't think that's a limiter right now. At the end of the day, being autonomous, yes, that gives us more freedom. But if our profession has to work under the guidance of a physician, it would be really nice if our practice acts were similar all around the country. How do we continue to make ourselves better with that? If I came in with dry needling, functional movement screen, all these different certifications that on paper, from a knowledge base, I'm top of the top. I am the man or the woman, it doesn't matter. And I go to this institution or organization or whatever it may be, and I don't get the salary that I want. I'm going to be feeling like I did all this and I can provide more. Now, if I was in this institution and in this organization and I had the opportunity to get a dry needling certification, a functional movement screen while I was in that institution, now those hiring managers, HR, whatever it may be, now see that I've put into work to provide more. So that is another opportunity to ask for more money, that whoever is my hiring manager see that I'm making this progress to make myself better versus this individual that's coming in that's already better. So now they're investing in you to make yourself better. So when it comes to even the autonomous piece, it would be so ideal to be able to have all these certification, again, the practice acts similar all over, that I can provide these things and charge for them. Okay. When we talk about just the settings, there's going to be gaps in a setting. That's how it is. That is life. Outside of athletic training, there's gaps in the business world. There's gaps in the medical and positions. There's gaps in everything. So each setting is going to, an individual could potentially make more than the other. So from a reimbursement standpoint, are you going to be able to be reimbursed in your own clinic, in your own performance center versus the PT clinic versus just the physician CAS-based practice? And again, if the Practice Act is pretty clear from a physician standpoint, I think that certainly helps.
Adam, one of the things I know that you focus on is how ATs can better show their value, and that the revenue or the income that they get is probably going to be somewhat reliant on that. Can you talk a little bit about your thoughts there?
Yeah, so I think this conversation about reimbursement, about autonomous practice, these are all symptoms and they're not the diagnosis. I think the diagnosis is our versatility. We have a versatility problem. And I mean that in a good way and a bad way. We are very versatile to where we can practice with a large population and apply our services in many different settings. But our versatility also kills us because it's hard to clearly articulate what we bring to the table. Murphy, you talked about how there's gaps no matter what profession or setting you're in. And athletic training needs to show that we can be versatile and fill gaps, but that we also fill our own gap within our own population, our own setting. So I think versatility really kills us because we can't speak to that very clearly. We can't articulate to the athletic director, this is why you need to hire me. And this is why I command this salary, because I am filling this gap for you. If they can understand the gap that you're filling and you could put a price tag on that, that moves needles, right? And so the systems approach that I think I really operate under is How do we firmly articulate what we do and show others that we can fill their problems or solve their problems? Because that then builds worth and that builds value. I think reimbursement matters. I think upskilling matters. I think autonomy matters. But those are conversations that we have after the fact. Unless we can really sell our versatility, then I think we're still going to struggle with all of these symptoms and we never really come to the diagnosis.
And then there's an identity discussion, right? And I'm sitting right next to Mollie, so I'm going to give myself a little bit more space here and scooch over because she's new. But there's been an age-old debate on titles. So my question for this group today is, do we feel like the title athletic trainer is holding the profession back from being able to accomplish all of this? And if so, is the solution really changing the title, or is it truly changing how people understand the role that we play? I've seen other health professions actually recently do this, and I have to tell you, from an association management standpoint, it's not as easy as just saying, you're going to call us this now. There's huge regulatory and legislative lists. So I approach this question cautiously, but interested to know what your guys' take on it is.
I'll start. I like the thought of a potential name change. I like the thought of athletic therapist. And when it comes to that last piece that you mentioned, Katie, about some legislative implications, I think therapist is therapist, whether it's a physical therapist piece or an athletic therapist. When we just think about the change there, yes, it's going to take a little bit for the world to understand that piece to it, but everyone is an athlete somehow, some way, whether it's the weekend warrior, where it is that person that's 65 years old, that's coming off a hip replacement, that is in the clinic, and you're trying to get them to be able to do step ups or step downs so they can get around their home. We make it competitive for these individuals to get better. So that is an athletic frame of mind. And that's what we know. Like when you think about the education piece, we are all educated in the collegiate setting. That is usually our first piece of where we're going to get any athletic training knowledge, is in that team sports setting. So we are competitive by nature. And by continuing to utilize that as our advantage, by using that term athletic on the front end, I think it is super key. And I think it could go a really long way. But like Adam said, telling the story of the athletic trainer, I think, is so important. We were MacGyver when I was growing up. We could do all these things, but who's telling that story now? Who's telling that story about what the athletic trainers do? We got a lot of notoriety with Damar Hamlin, and we're saving all these lives. But what about the lives that we are saving before the cardiac arrest, before the C-spine injury? We are having conversations with student athletes, people in the working world every day, and we are saving their lives. So it is our day-to-day jobs that are saving the lives, not that one episode that we should get the notoriety. So that, I think, is another important piece to this. Again, compensation task force, maybe that becomes a committee that we can continue to look at this on a regular basis versus when Tyler gets hit up in his message box about it. It is something that needs to be ongoing because this isn't a new conversation. People have been talking about salaries for 15, 20 years. So having the task force committee, I think, was huge. But let's have a committee in which this is looked at on a regular basis.
I'm sure the legislative process of changing out our title is a hellhole and something I want nothing to do with. I'll just go out and say that because I'm sure that's just a massive problem. But I second what Murphy said. I think that we do need a title change. Speaking on my own behalf, when I took this private role with my NBA athlete, we finalized the term of performance therapist because I think it directly speaks to what I do more than just athletic training, right? I have a background in, but it's like what I brought up earlier, strength and conditioning, they know it's strength and conditioning, massage, whatever it is. If I say I'm a performance therapist, like people in the public can grasp that. I feel a lot better. Even athletic therapists, people can grasp that versus this word that, in my opinion, haunts us and has haunted us forever of trainer. Now, again, I like the term performance therapist because that's exactly what Murphy just said. Everything that we do is athletic or it's some type of performance, right? Even for the people that don't think that they're being an athlete or working on performance, it's like everything that we do is some level of performance and it's all relative based on the person that we're working with. I love the idea of a title change. I think that, again, step forward into a new light. I think that a title change should probably come with it, in my opinion. If we do want to go from working behind the scenes to out front, I would go all the way in. Don't dip the toes in, but dive all the way in. I truly think that would make it at least more notable to where public understand what we're doing. And again, because right now, the only people that know what athletic trainers do are athletes and coaches. And I would love to say ADs, but clearly they don't know what the hell they're talking about.
I would add, I'm all for a name change. Being on the government affairs side of NATA has been enlightening because if you think about the process to change a practice act, that is the legislative process. And you are requiring on money and paying lobbyists and then moving the needle with legislators to vote in favor. And so it's a tall task. Not to say I'm against it. I do think, though, interestingly, it's important to note that perception is reality, and employers are not going to fund something or pay for something that they don't know what it is, right? So if our title doesn't help move the needle on that, it's going to be hard. But in a serendipitous way, I think we live in a time right now where performance health, performance therapy, or performance is really popular. And this idea of movement and wellness and health and what have you. And if we go back to our title itself, athletic trainer, trainer is simply defined as someone who trains somebody else. That is what we do every single day. And I think a byproduct of this debate is we've spent so much time trying to align us with the medical side of the industry to chase after reimbursement, chase after being recognized, that we've almost lost track of the fact that we live in that in-between world of performance in medicine. Like physical therapists that I speak to, physicians that I speak to, they speak to that gap in how athletic trainers can truly excel in that middle ground. And so maybe we come full circle and we start embracing athletic trainer in the sense that we live in that gap. Does that move the needle with employers right now? Maybe not. Is it sexy? No, I think performance therapists or performance health specialists or something is a little bit more sexy, a little bit more trendy. But maybe we can start embracing the trainer side a little bit more. And I talk about this on my platforms. When someone says, oh, so you work somebody out, when I say I'm an athletic trainer, I say, yes, and let me tell you what else I do. Because for far too long, the conversation was, no, I don't do that. I do risk mitigation, emergency care, blah, blah, blah. All really important domains are gold, but people don't understand that as much as they understand the performance space. So
let's switch gears a little bit and let's talk about the association's role in all this. What do you think?
Yeah. So I can start with NATA's role. I think, Tyler, you brought up unionization or strikes or that sort of thing earlier. And I think in many places, especially in medicine, we're seeing that more and more as a possible solution. NATA is an association. So we actually, because of antitrust laws and other things like that, cannot function as a union. If we could, and I could just say, hey, everybody should pay athletic trainers $100,000 a year, and here's why, and let's put that out there and enforce it. I would love to do that tomorrow if I could. We can't necessarily do that tomorrow, but what we can do is to equip athletic trainers to advocate for themselves in a lot of places. Unionization will always be an option, and I do think we should get into that a little bit more, but there's also an opportunity to flip that around, and as you guys were just talking about, to engage the employers directly.
Yeah, and that's what I'm super excited about as we evolve this and having you come into leadership, because I think for a really long time, and Murphy and Adam, feel free to disagree with me if you want to, but I think as an association, we've been so focused on helping the athletic trainer as an individual be the solution. So it's here's the resources, here's the tools, here's how to arm you, go get it done. I think NATA can, and we are starting to change that perspective a little bit in how can we as the entity be the voice of that profession and go directly to the employer to, in essence, pave that runway so that employer is ready to have that conversation and say yes long before the AT ever enters the room to make the ask.
Yeah, they have to understand what an AT does. I think we have certainly an advocacy role, but the employer education piece, the AT visibility piece, and public education about what an AT is, that really falls to us as an association. I know that we've done a lot in the past, and I think that I hope that you'll see us doing even more along those lines in the future. Adam and Tyler and Murphy, what do you think of that approach? Is that a necessary part of this equation?
I think it definitely helps, but we're also talking about, you telling me schools and the ADs and the directors of sports medicines don't know athletic trainers and the value of athletic trainers already? It's like they do, they know they do. But it's because, especially at that level, there's so many hands out that when the Big Ten comes in and goes, hey, everybody's getting X amount of $50 million, that's gone long before it even gets down to anyone on the support staff. I guess it's not even close, right? So this is where I talk about unionizing, and I do think that there's a piece where like a union and the NATA could work together. They can't work separate by any means. I think the unionization of athletic training is just a reflection of where the profession currently sits. Again, we know undervalued in terms of compensation, workload, recognition, everything. But I think that where the union might come in, and this is what you're talking about, but it gives structure that provides protection, leverage, and a stronger collective voice. That's being said, I'll be the first person to say the unionization, I don't think it's a one-size-fits-all solution. It can be very powerful, but in others, it might not address the root issues that athletic trainers face, especially when we're talking about tied in the broader systems of healthcare, reimbursement, administrative understanding, and organizational structures. So unions will work best in environments that, again, have clearly defined and employees share similar responsibilities, and employer systems is really not where we sit, right? Unless you are part of that medical hospital model, which a lot of teams, USC, some other ones are starting to bring on. It's like the unions can help standardize those pay and hopefully protect against burnout, because they're also standardizing against hours and putting a cap on that. So it creates clear expectations. Now, where they struggle is, and probably wouldn't even work for me at this point, right? Because in more dynamic and individualized environments like private practices, performance settings, hybrid roles that require flexibility and the adaptability, it's probably not going to have any type of effect for that. So then that's where I would say the NATA probably comes in bigger from a advocacy piece. The union thing that I bring up, it's not going to fix everything. They don't fix everything. It would only provide leverage and structure, but the outcomes still depend on the leadership, the negotiation, and the member engagement at the end of the day. That's just the reality of it. I think it's all pieces to the puzzle. I think that the NATA and a union could possibly work together in that sense. But again, I think we're running into a wall where I'm looking at these colleges that are making a ton of money, but they're still operating in a massive debt. And then they get all this money. It's that AD and coach and whoever else, strength coach, they're going to take their cut before it ever comes down to an athletic trainer.
Your role at UT is pretty interesting because you work very close with leadership at the collegiate level. So do you want to add some stuff to that?
Yeah, and so I also serve as faculty athletics rep, which is a presidential appointment, and I work hand in hand with our athletic director, who's phenomenal. And I've had a lot of conversations with athletic directors across the country, and I think a lot of them get it. I think a lot of them understand, but they are coming from a business standpoint. It's return on investment. And if our sell is hire me and pay me $90,000 so I can stand on a sideline in case something happens, that's a really hard sell for an athletic director who only has X amount. Tyler, you talk about it all the time. If we are at the bottom rung and we are downstream and whatever's left over is provided to us, then that's going to be a problem. we need to position ourselves, and maybe this is where a union and the NATA can help get us there. We need to position ourselves where we're at the top rung. We are not fighting for scraps. We are owning our system. We are owning what we provide. And we are directly going to the AD and saying, this is what you're getting from us. Yes, part of that is safety. Part of that is us instilling a system to ensure that no matter what happens at any time of day, the system will respond accordingly. It's not one person. It is the system that we instill around safety. It's a system that we instill around quality. You're going to get quality type services, and we can show that and back that up through data. So if we're passive, if we rely on waiting for our hands to be filled, then I think we already missed the boat. I think we need to align ourselves the higher rung. And like I said, going back, I don't think the conversation is union or association, one or the other. The association has a very specific role, and the union can have a very specific role within a workplace. Us as athletic trainers, I think we need both to be really strong. A union, if it makes sense within a collective bargaining, but the association has to be really strong as well. And I wholeheartedly agree that the association maybe spent a lot of time on developing resources for the individual clinician. That's really important. Now, the next step, I'm excited to see what rolls out, to have conversations with the AD who has that business mindset of athletic trainers are standing on the sideline. So I'm going to hire the lowest paid I can get because I check that box of coverage or liability. So I think the NATA has a gap that they can fill, and I'm willing to do my part to help you guys fill that.
Real quick before Murphy goes, I just want to say one thing. You just brought up ROI, and I think that right now athletic trainers are like, this really should be our time to shine. When you're talking about the amount of NIL money that's coming into these athletes at the college level and high school, you want to talk about ROI? Dudes are getting paid $8 million and they're still they're out there. They're maintaining to be out there for 6 months. That's no different than, what Murphy does with the Cavs, what I do with my athletes. It's ability. The best ability is availability. ROI right there. You just dumped in $10 million into this one athlete to make a deep run into the tournament. He didn't miss any games. Where's the ROI on that? You have to find a way to tie us not into NIL, but into that conversation, because I do think that's what's going to bring us from that bottom rung up higher to where it's, most of these kids now, you're only going to have them for 6 months, right? There's no longer this process of we're going to develop a kid from a freshman to a senior. That's long gone. So it's like, your ROI is you're going to dump this much money into this athlete and bring him in here. Your ROI is that they played X amount of games, right? And I truly think that there's a piece that we can tackle within that to really take to another level, in my opinion.
Tyler, I think you nailed it on the head. Continuity of care. That's what we preach all the time. Continuity of care. In the Division I setting, in college setting, which is a chaotic environment, your sports medicine and performance staff can be the only entity that is stable. So if you invest in that, if you invest in quality people that can operate a system that's going to provide you stability, your head coaches can come and go. Your players can come and go. You don't need to worry about what your sports medicine and your performance staffs are providing. You invested in them. You believe in them. So everything else can be chaotic. This can be the one continuity piece within a collegiate setting. I love what you're talking about.
Yeah, I think that is key. But I'm going to say to Adam, Tyler, people are doing that. People are showing up and saying this is the continuity of care, but where's it going? When we talk about what the NATA can do when it comes to engaging employers, I love the thought. I'm not sure how it's going to happen, but I definitely want to be a part of that talking point, that committee or whatever to do it. There's a lot of employers that the NATA and a union's trying to have a conversation with. It's astronomical from the NATA standpoint to be able to have conversation with the Texas High School Association, the Texas schools, even if they have their own certification, to LA, to the collegiate setting, to NAI schools. That's a huge undertaking. It can happen if we put our minds to it to make it happen. The union piece, I'm still trying to figure out for those exact same reasons how that will happen and how that can be beneficial. I look at individuals who are employed athletic training wise around the country, and definitely at the collegiate setting. They are at-will employees, okay? There are some benefits to being an at-will employee when it comes to just having flexibility. If another job come up, man, I can resign from this job and I can move to the next job, whether it's for pay, whatever it may be. My family needs to move. There are some other individuals that are in a profession that are making a ton of money because they're contractual employees, which is a better benefit for the athletic trainer. I'm not sure. A contract sounds really good, knowing that regardless of what happens, I'm going to get the salary. But if I'm on a 3-year contract making $500,000 and the next schools, I'll give you $600,000, and you have to break that contract, that means you're paying back some money. So I think from an education standpoint, and we talked about this in the compensation task force, we are learning so much through our education. We learn how to interview. We go through the interview process, mock interviews, but who's really teaching us how to have those conversations about salaries, fringe benefits, all those things, how to ask for a raise? We're not taught those things. It's not until we get into that space in which we have to ask our employee for a raise and we're trying to figure out how to do it. If we come armed with that, now we can speak like we know what we're talking about. There are some other, if it's the hospital setting, it doesn't matter. If we have that ability to learn these pieces and these integral things on how to continue to sell ourselves on the return of investment that we're doing, the continuity of care, that will help us when it comes to asking for more money. Everybody knows I'm not going to say everyone, but you hit it on head, Tyler. Like the AD comes in and they know you are behind the scenes and you're always here and you're doing X, Y, and Z until you have to stand in front of them as I want a $10,000 raise. How are we approaching that? I think that is really important. And we have to learn that. We have to be able to learn how to ask those questions. People in the business world understand how to ask those questions.
Yep.
I love it.
I got one last thing to say, because you brought up like a really good point as far as like how contract versus at will and like how like which is better and in what capacity. And for the longest time, like athletic trainers were deemed safe, right? Like coaches could come in, get fired, go, whatever. The athletic trainer was the one thing that was always consistent and
Right.
we were always safe. And that's how it always should have been. And I would always relate that to being like, we weren't on a coaching contract, which means that there's less volatility, but we made less money being not on that contract. Now we're seeing that change at the division level where a coach can come in and say, you're out of here. And I can tell you right now, my boys over at Penn State just got handed the axe. And that is something now. It's why aren't we on contracts? We might as well, like you said, I'd rather be on a $180,000 contract for 3 years and make that money and then at least have a chance to renegotiate after 3 years than sit here and make 50 and be like, oh, I'm safe until I'm not. So that is, again, it's a whole nother conversation, but that's a piece now to where we're not making any money. We're getting burned out working shitty hours, and now we're going to get fired as soon as a new coach comes in, which is going to be a revolving door. So now really it's like, what are we doing? What's the promise here for our profession? And that's something that I get asked a lot. Young athletic trainers reach out to me all the time. And it's not like I'm going to sit here and lie to them, but I'm going to tell them straight up, I would be dual certified. I would have all these different things outside of athletic training because yes, a new coach might come in and it's over with. And it doesn't matter if you have 20 years as the head football athletic trainer or whatever it might be. And the school can sit here and say all day, you're going to be safe. You're going to withstand all the turnover. That's horse shit. Because as soon as a new coach comes in and they're the ones with the power, it doesn't matter. Because you know what? They're going to go with a guy that's making 20 million over the guy that's making 60,000 all day. And that's an issue. And that is something that has to be addressed yesterday. And I don't know how that gets addressed, but that has to be addressed immediately. That's the reality of it.
So I think this has been really good discussion so far. I want to take a quick minute and get Mollie's insight from the POV of being a association management professional. Differences of professional associations versus unions, any legal considerations in the differences, what they can do, what they can't do. And being that you have recently come from outside of NATA, what have you seen other associations do?
Unionization has certainly been a hot topic in the medical world lately. There are places where it has been really effective, and there are places where it has really caused a lot of problems for both organizations, but also for the individuals who wanted to get involved and thought that unionization might be the right tool to get there. So I think as we are having that conversation at any level, we need to be very thoughtful about the right way that, for example, NATA as a professional association can work in tandem with or in lieu of a union where it makes the most sense. So in general, professional associations exist to advance a profession. So that might be promoting professional standards and ethics, providing education, certification, supporting researching and networking, career development, and then just advocating for the profession broadly through things like public policy, scope of practice, for us, the practice acts at the state level, of course. So NATA obviously is an example of that. Unions exist really to protect the interests of the workers in a specific employment setting. So they would negotiate wages and benefits and working conditions, enforce labor contracts, represent workers if they have grievances or disciplinary actions, and organize collective action like strikes where that's a possibility. Coming from emergency medicine, I can say it's a very complicated world, and there are a lot of nuances. In fact, what we found in emergency medicine is that different unions have different levels of influence in different areas of the country. So in a lot of cases, there were specific groups of emergency physicians who would team up with the teachers union or with the Teamsters or with others who have already established themselves in that area of the country. But it was also complicated because emergency physicians would be grouped not just with other emergency physicians, but in a lot of cases, anybody who worked in the emergency department. And so suddenly you had people who were negotiating on behalf of the emergency physicians, but also others who work in the ED, medical technicians, or staff who triage as people come in the door, and all different roles that might just be all in that department. Alternatively, they were getting grouped in with all physicians. And so then again, you still don't have necessarily the right group or the right person that's going to advocate for you as a smaller individual profession, because it's a lot more advantageous to join a group that already exists.
And I think it's important to add here, too, that not one solution fits all plans, right? Some states, unions are a great solution and they work because the state is a pro-union body. Some states, you can't even get a union up off the ground because there's just so much red tape needed for it to work in that state. And so it really seems like when you're trying to decide on this, does a union work, does it not? It really needs to be thought of on a smaller scale, maybe a setting-based scale, maybe even as small as employer-based scale. But I do think there's an opportunity for us to bring more education and information to inform the profession on the difference between the two. I think the biggest thing that when I was prepping for this episode is the legal differences. Do you have more info on that?
I do. Associations cannot legally negotiate any employment terms on behalf of our members or require employers to recognize them. Our influence really comes through persuasion and advocacy and reputation. Unions, which are a separate kind of incorporated entity, they have legally protected collective bargaining rights under laws like the U.S. National Labor Relations Act. Employers might actually be legally required to negotiate with the unions, and there are processes behind that. Contracts are binding and enforceable, and they can file unfair labor practice charges and other things like that. There is a very complicated process to get unions started, and it actually requires a degree of risk on the people who are starting down that path before the laws kick in that protect them. And so as that is a consideration, there are thoughtful conversations that need to happen without certain people in the room in order for it to even have a chance of success. And certainly healthcare systems are used to keeping an eye out for this. Again, I think this would be a great future episode for us to unpack even more, but there's a lot to consider and definitely not the role of NATA to serve in that capacity.
It's a lot to unpack, and we knew we were going to run out of time, and we've gotten to that point. So hold all those thoughts for part 2 coming soon. But for now, let's bring this one home for today. So a couple of final wrap-up questions for our guests. What do you think is one thing ATs can do today to better position themselves for higher compensation? You have to limit it to one.
I'll start. I would just say, as an athletic trainer, from day one, believe in yourself. Continue to work to make yourself better. These are the things that you can control. All the things that we're talking about here are out of this individual's control, except for making themselves better and maybe getting educated on how to fend for themselves when it comes to the salary topic.
I would say be an elite documenter, because as that improves, it will continue to show your ROI, and possibly you can use that data moving forward into things that you may or may not have prevented, but it plays a role into saying, look, out of all these different injuries, this person returned an X amount when they were expected to turn, and they returned in 2 weeks instead of 6 weeks, things like that. If you can do that again, it plays into that ROI, and then you can take it to the bosses and the powers that be and try and make a case for yourself on it.
Picking up on that, rather than making yourself busy by doing busy work, invest in time well spent in improving the quality that you can take to your administrator. Get really good with documentation, as Tyler said. Pick a metric or two that you want to hang your hat on, that you can then go and say, look, this is the value that I'm bringing to this organization. And for me, early in my career, it was, here's the number of players that are available every single night on game night for the head coach to pick the very best player to win a game. Something simple, something easy. So whatever is your forte or your expertise, find 1 or 2 data points that you can show that you are providing quality service, because that is going to speak to ROI, and that is going to speak to the administrators.
From my seat, what could NATA be doing more of? And is there anything that's given you hope that we're heading in the right direction?
You guys have to get more out there. And I know that's a loaded thing, but it's, again, just little things like, this sounds stupid, but I'm going to say it. I shouldn't have a bigger Instagram following than you guys do, right? Like, there should be, every athletic trainer should be invested into the NATA. And a big piece of that is that, I said this earlier, my life doesn't change whether I'm part of the NATA or not. And that's an issue, because there should be a gap where you're not part of this, and here's the things that you're not getting with this. And I think that's where the NATA should really step up and highlight via social media, new user graphic designer to highlight everything and whatnot, and be like, this is why we are so good and so powerful, and the things that if you're not with us that you're missing out on. And I think that's gonna, in my opinion, from a quick feedback piece, that where I think you guys get a lot of benefit for sure.
What would you say to the people who think that those who are benefiting from the work that we do but aren't members are freeloaders?
I agree. It is what it is. But until there's a reason that it's like, again, like there's got to be a reason for me to want to join. And you can call me a freeloader, but at the end of the day, is, again, like my day-to-day practice, how I pursue everything, like that doesn't change no matter what. So it's maybe when I was in the college setting, I'd have more basis for it and stuff like that. But again, like I need more reasoning of to be like, this is why you should be a part of it. And honestly, if I were you guys, I don't know if this is possible or not, I would require every athletic trainer to be a member. I would just like blanket rule, like
I would love to do that.
If I like why not? Like, you're going to the employers already and be like, it's required that they have to be a part of the NATA moving forward.
So here's where I'm going to tell you that for director of membership. So I'm going to step in on a soapbox for a hot minute, and then Mollie's going to mute me when I've gone too far. I agree with you. I would love to require membership for everybody, but the reality is we're not allowed to do that. So you make a great point. We could be telling the story differently in a way that resonates value to our members. But I, as an individual on staff, can't do that alone. I need the influencers, other AT influencers like you, Tyler, like Adam, and others to help us get that message out there as well. Because I think for a long time, people look at NATA as this institution on a high hill, which is fine to think of us that way if you want to. But think about how much more we could get done if we were collectively doing it in the same direction. And so I hope, if nothing else today, I hope this conversation is the start of a renewed relationship, of a strengthened relationship, because one Instagram account having one message is something, but one message that gets reposted and reshared and has collective agreement that says NATA says this, and Tyler agrees that it's important, and Adam agrees that it's important, and Anonymous ATC says it's important, that's going to make waves. And that's what we need to start doing. So I hope, like I said, I hope today is a great start in the right direction. I hope it keeps channels open for continual communication. I think for a long time, we've taken a one pathway and said, see ya, but we can't do it by ourselves. I think it would be silly for us to think we could. We have to do it together. Adam, Murphy, I'd love to get your thoughts on this too before we wrap up.
Yeah, just to go back, what gives me hope is the fact that we're having conversations like this. There's a lot of young athletic trainers that are asking better questions than even when I first started in the profession. So that gives me hope because people still care. You don't want to ask tough questions if you didn't care. So I still think people care, and that gives me hope. And I think for the NATA and moving forward, you look at any professional association, memberships are going to come up and down, and you're not going to get full participation. For the NATA, you need to make something sexy that people want to be a part of. And sometimes that is appealing to the member, but sometimes that's making the profession better. And if there's freeloaders, you don't worry about that. You just keep your eyes on the prize and make this profession better for everyone. And hopefully by doing that, then people start joining the party. And I think that can happen.
Yeah, I agree with you, Adam. I'm glad that we're having a conversation, but it shouldn't be a conversation and reaction to what individuals are saying. Like I said early on, this conversation has been going on since I've been in the profession. And now my son is about to get into the profession. So even more, it just needs to be something that's continued to have the association standpoint. Yes, the idea about employer engagement is ideal. Let's continue to talk about to move it forward instead of us just having the conversation right now. There's some people that are really smart out there. Tyler is bringing some energy to this. Let's utilize those individuals to continue to move us forward. And Katie, you know this, I always say, if we're not moving forward, we're getting passed up. And a lot of individuals have been passed up from a salary standpoint. So let's continue to work to try to solve forward.
When was the last time the NATA had an athletic trainer as a keynote speaker? Was it last year or
One play last year and the year before that?
I think 2 this year as keynotes.
Yep.
Yeah, it's important. And we see the same thing, actually. We've been talking about it with like our journal, the Journal of Athletic Training. A lot of the authors, in fact, most of the authors are not athletic trainers. And we would love to see more ATs step up and take the lead in the evolution of our own profession and our own practice. That is, you're right on. That's all stuff that we need to be supporting.
And I think it'll come in time. Like I said, we talked about earlier, I think for a very long time, the association has said, you as an individual should do this. You should do this. You should do this. And they've always been looking to us. Okay, we'll do this. But what are you bringing to the table for us too? Because it should be a partnership. As an individual, you're making an investment in your association to help rise your tide, because a rising tide lifts all boats. That's a shout out to Chad. But we've never really been great at explaining and telling the story of just how high that tide is rising so that those boats benefit from it. I know we've been doing it. It's not that we haven't been doing it. It's just making sure that we're telling the story in a way that they see that we're just as much in the game as they are as individuals. And I think once people start seeing that again, you will start seeing more people in JAT. You will start seeing more people want to get up and speak at convention. You will start seeing more hands raising for membership and volunteering. And it's a new day at NATA, baby. I can't wait to see what happens in the next 9 to 12 months. It's going to be great.
And I think this speaks to the power of the association as well in general. If you want to get involved, if you are willing to go to the Hill, if you are willing to get involved, we have a spot for you. We would love for you to come and help us change it. We want to change and improve AT across all settings as much as we can. But if you can't or don't have the interest or the time to be able to come and do it yourself, do support other people to be in those rooms where you can't be, or in the right rooms where those decisions are being made. That is where we as an ATA have access that an individual might not, and why being part, even if it's just by being a member and not doing anything else, that supports the whole cause for everybody. And it is one way that we can help you have a better day as an athletic trainer every single day. So this was a tough conversation, obviously a necessary one, and one that will continue. Huge thank you to our guests for joining us today for this critical discussion.
Listen, at the end of the day, this isn't just about salary. It's about sustainability of the profession. ATs, we're highly educated, we're highly skilled healthcare professionals, and this conversation really is just making sure that value is recognized across every setting.
And we know we didn't cover everything today. In fact, our latest salary survey data is currently being analyzed. I haven't even seen it yet, but I have high hopes that at least we've got the data to start working from. Yeah. And that we're expecting that report to be coming out. It'll be interesting to see what the themes are and to continue this conversation after we have a new round of data in hand.
Yeah, and as Mollie just said, this is truly a beginning, and we plan to continue the conversation, whether it's part 2 or additional discussions through other formats. We know that salary and money in pocket is truly one of the highest, if not the highest, pain point across the profession.
And we want to hear from everybody about what resonated, what we missed, what questions you have, what future episodes you'd like to see.
So if you have feedback or questions or things that you want us to cover either on this topic or a future topic, make sure to send us an email at podcast@nata.org. We truly want to use the input to shape future episodes. Tyler did a great job collecting feedback that really shaped the questions we asked on this episode, and it helps us continue the conversations in meaningful ways.
If this episode resonated with you, please share it with a colleague and help us keep that conversation going, because it really is a new day at the NATA.
Awesome. Thanks, everybody, for listening. Until next time from the NATA-Cast. As a member myself, I know how valuable it is to stay connected to the athletic training profession. Joining NATA means becoming part of a national community that supports athletic trainers through education, advocacy, and professional resources. Membership also connects you with the colleagues across many practice settings who are working to advance the profession together. Whether you're early in your career or have been practicing for years, NATA helps keep you informed and engaged. If you're interested in joining or renewing, visit nata.org/membership.